Hello, everyone. I hope you're enjoying our menopause series. My name is Dr. Briana Lutz. I'm a naturopathic doctor and registered herbalist and one of the practicing NDs at Flow Functional Healthcare. And I will be talking about botanicals in perimenopause. So, I always like to start the conversation around botanicals in perimenopause in that it doesn't need to be a one or the other approach. So, if somebody is pursuing hormonal therapy, they can also use botanical medicine to complement that, and they can work very well synergistically and can complement one another. When we look at some of the targeted herbal actions or approaches, one aspect is can we incorporate hormone normalizers? So while we can't prevent that transition of the reverse puberty that is perimenopause, we can look to offer better stabilization or hormone regulation through that hormonal transition. Phytoestrogens or plant-based estrogens function as what we call partial agonists, so they can weakly bind to estrogen receptors for more of a balancing estrogen effect or more of a modulatory effect. Adaptogens are pretty unique when it comes to naturopathic medicine and botanical medicine and isn't necessarily something that we can approach from a conventional lens. But this is looking to promote the body's resilience to stress and physiological stress associated with hormonal change. And we'll talk about ways and why that's important in this hormonal transition. Now, as part of a comprehensive treatment strategy, if we're not getting good improvements in all of your symptoms, we can offer individual or tweak symptom relief in terms of what you need additional support with. So, this could be herbs targeting heavy bleeding, this could be digestive concerns associated with hormonal changes, this could be sleep support in both falling and staying asleep. So, we can adjust your treatment plan based off of your experience. When we look to hormone normalizers, I often think of where is this person in the perimenopausal transition? Are they early perimenopause where we can have more of a modulatory support? Maybe we're focusing on progesterone production. Or is somebody post-menopause where the therapeutic strategy might be slightly different based on what their hormones are naturally doing at that point? So chaste tree works on brain hormone, so your follicle stimulating hormone and your luteinizing hormone to promote hormone signaling and cycle regularity. Where we see some of the best benefit of this is if somebody is still ovulating or maybe starting to ovulate less frequently, that it has antioxidants to support the remnant of the egg called the corpus luteum that is supporting your progesterone production. So it's enhancing progesterone as much as it can through that process. However, post menopause, we may not see some of the great advantages of chaste tree because you're no longer ovulating. We do see that it can be beneficial or mildly beneficial for estrogen support. So, weaker estrogen receptors called beta estrogen receptors that are on the bones or the brain. So, we can have mild estrogen support to more of those peripheral tissues like the bone and the brain. Bones and the brain. Black cohosh can be useful throughout the perimenopausal transition. So whether that be early perimenopause or postmenopause, again, it is working on those brain hormones, follicle stimulating hormone and luteinizing hormone for more of an estrogenic effect. So this looks to promote estrogen production, and it is not a phytoestrogen or a plant-based estrogen. So we can see really good benefits on symptoms related to estrogen change. And a lot of those hormonal symptoms in perimenopause are not necessarily directly related to your estrogen level, but it's the change in your estrogen that is triggering those symptoms. So, vasomotor symptoms like hot flashes and night sweats are often related to that hormonal change and that stress on our temperature regulation and our system there. Black cohosh can also support our dopamine levels through estrogen. So we can see that being related to enhanced cravings or brain fog or difficulties with concentration, some mood support. So black cohosh can have some great utility in managing those estrogen based symptoms. When we look at phytoestrogens, these are important to modulate or balance our estrogen during hormonal fluctuations or act like estrogen when it's low. So, especially in postmenopause, to enhance or bind to those estrogen receptors as much as possible. So, there's three different classes of phytoestrogens, and some of these can be food-based or also related to herbal extractions and teas, tinctures. So lignans would be present in things like flaxseed or milk thistle. Coumadins are in soybean, clover, alfalfa, and isoflavones in herbs such as hops and licorice. Not the black licorice, but a different type of licorice. Now, adaptogens are, again, like I said, a unique kind of category or therapeutic support in perimenopause because our adaptogens are helping the body to adapt to stress. Why is this important in perimenopause? It's looking to stabilize and support our circadian rhythm, so how cortisol peaks in the morning and tapers off throughout the day to allow us to fall asleep at night. So when we're enhancing that circadian rhythm, ideally we're getting better energy and deeper, more restful sleep. Adaptogens are also looking to support cognitive function and mood, both directly or indirectly, if it's a secondary mechanism of that herb. And we're looking to support hormonal function of the adrenal gland. Why that's important in postmenopause is that because the ovaries are no longer responsible for like a lot of our estrogen production, a lot of other tissues are then creating estrogen, including the adrenal gland. So if there's extra stressors on the adrenal gland, they maybe are not as supportive in its role in producing estrogen, and supporting adrenal gland function can improve our estrogen production indirectly. So some of my favorite adaptogens in perimenopause include rhodiola, which is a very cooling herb. It supports cognitive function. It's a cardiovascular protective herb. It works as a selective estrogen receptor modulator, so enhances estrogen. And it also has a direct relationship with serotonin, so it can help with mood-based symptoms associated with estrogen change. Ashwagandha is also a really beautiful herb in supporting our system through perimenopause, especially in early perimenopause, where there's a lot of progesterone changes. So it can be supportive for progesterone levels, and that can translate to irritability or agitation or anxiety because of its support both with progesterone and enhancing GABA, so calming our nervous system. And we see that as a really great benefit also with what we call sleep architecture. So guiding our body through our different stages of sleep. So it not only helps you fall asleep, but stay asleep, especially that 1 to 3 a.m. progesterone witching hour. A point I like to make about adaptogens, especially adaptogens for hormonal support, is that extraction is really important. So in ashwagandha tea, water is not a fabulous solvent for extracting key constituents that will actually work on cortisol or some of these hormonal mechanisms. As a tea, it might be like a great antioxidant or anti-inflammatory. So you do need either standardized extractions like a tincture or constituents through a standardized process, such as in certain capsules and that kind of thing. So teas, powders are not as effective, especially for the hormonal support. When we look at symptom support, we are supporting always the underlying hormonal changes, and we can adjust our interventions based as needed for symptom management. So some of our herbal helpers that we might see in perimenopause, things like sage, which can be really helpful for our vasomotor symptoms, so hot flashes and night sweats. Saffron, which is a really beautiful mood support and has some benefit in enhancing libido. Shepherd's purse is a really great uterine tonic, so helping to prevent or reduce heavy menstrual bleeding. And lion's mane is a mushroom that looks to support cognitive function, concentration, memory, again, especially associated with our estrogen receptors in our brain when we want to enhance cognitive function and brain support. So I hope you learned quite a bit about botanical medicine in perimenopause. Botanical medicine can be a really great adjunct to hormone therapy, or it can be a soul-based therapeutic strategy, depending on the individual. So all of our doctors can help with consulting about that.